jeez. Stephen. Oh, Stephen, I need you to get down from there.
You hear me a little hot. Oh, God. We're hurt. Help.
Oh, my car.
Sorry.
Jeez. Stephen.
Whoop. Whew.
Sorry about your car.
That's fine. Doesn't seem
We
too
were
core
in a
damage.
little, we were in a little bit of an emergency. So
That's fine.
I barely made it in time. I collapsed at the door.
Oh, glad stuff is okay now.
Thanks. I see here.
Yeah, sorry about that on
See you.
his behalf.
You're all good.
Hello, Jala.
Hey.
Oh, I'm bleeding.
Oh, better take care of that.
Um, yeah, I was working in the warehouse. I must have ran past something that was like a jagged metal piece or something. Holy crap!
Yeah, I guess.
Hello, sir.
Hey, can I help you?
Yes, I was working in the warehouse, and you were kind of horse playing with some forklifts,
Oh,
and I think I got a huge laceration because I was leaving a trail of blood, and I was feeling something going running down my leg.
Kiddo.
oh man. Okay. Um, let me just try to get you
You want to play the
stabilized
puppy?
here real quick. Okay. Can I help you?
I don't know if you can. I just have a splitting headache still, and took the painkillers and did a little bit, but still there.
You like getting blurry vision, stuff like that?
More joint and muscle pain every now and then, but I think that's
Hmm.
because I work out on and off.
Okay. Well, why don't you follow us back there? Take a seat on a bed. I'm gonna help him, then I'll get you some painkillers. All right?
Sure.
All right. Let's go ahead and hit the back. I'm gonna get you checked out here. All right. You said you felt it running down your.
Yeah,
My My bad. Oh man.
For some reason I just feel so tired now, Doc.
Yeah, it's definitely lost a lot of blood. Get your arm cleaned here, and we're gonna begin a transfusion like immediately. All right.
I hate needles, Doc.
Clean off that arm one more time.
Usually they give you a countdown before they hurt you.
I'm cleaning you. I didn't even put it in yet.
Oh, dang.
Over there.
That's what? God damn it.
Sorry. Try to take that.
That sting.
Just let that sit still. It'll settle.
I don't know if they were rusty either. I may need a tetanus shot. Because nobody washes them damn forklifts.
I wouldn't surprise me.
Steven, what is it, little boy?
Put the pen in there.
No!
Oh.
You don't get to play with that. If you want water, here it is.
Gosh, clean it out. Gonna have to
Jeez, kiddo, you make this very difficult.
reconnect the ends of the artery. So you stick very still. Very still.
Oh, man.
Okay, got that closed up. I'm gonna close up the outer leg here.
Are you gonna... You tell me you're using a stapler, god damn it!
I'm not stitching it, stitching it. I know you don't like the needles, but
The size of that needle's the size of a damn freaking bullet.
not quite.
We're talking about stapler. What?
He thought I was stapling his wound closed.
Yeah, it hurt.
I told him I was just using a lot of stitches. But yeah, you're looking good now. Just need to get it wrapped up and get you up on your feet here. Alright. Ready, go.
Hey, Jala.
Hey.
Alright.
Yeah, it's helping a tiny bit, but it's not helping, all the way.
Sure, it's a little tender still. I could put a little weight on it, but it's a little tender, man. Ooh, shit.
You're gonna need to.
All right. Well, we can go and get you administered.
No,
Yep.
I should be. Oh, what the hell?
Talk to me. What happened?
Your name, good sir?
Yes, it is Reiter, R-E-I-T-E-R.
Well, we got a good spot here. We can
a dirty
get you in for a
construction
MRI.
worker
Sure.
who has some hands.
You any experience any blurriness in double vision at all?
No double vision.
Okay.
Dirty construction worker touched me and hurt me.
Alright, well, sorry for that.
Oh.
Yeah. Alright, I don't see
Thank you,
anything too
Doc.
serious, just some bruising.
Okay.
I appreciate all the good work, man.
Alright, I'm gonna go ahead and get
I'll
some
stop
ice
in
on it,
later
and
on to
we'll
see if
get
I
you
can get them
The
stitches taken out.
hypochondriac,
Maybe
I'm
in like
sorry.
I don't know, like a week or so.
hypochondria.
Well, if
So you're kind of a
don't
plant?
mess around with them
Yeah.
too much, it
Oh,
should
this way.
dissolve
Ah,
or
got it.
Okay.
Oh, really? Is that new technology now?
Got it. Well, almost done
Yeah, it's
here.
just been hard to focus on things.
I'll get you on your feet,
Getting
okay?
harder and harder every day.
Just from the pain?
Yeah, I think.
Alright, hop on up. Let's get any metallic objects off you.
It's hard to remove my holster. I'm just gonna kind of put my stuff in a corner, I guess.
Oh, and put all in a in this box here. We'll keep it in the observation. Yeah. Yeah, it's best not to keep it in any vicinity to this room. That's a extremely powerful magnet there.
Your worker Kowalski? Chip or something?
Chip? Yeah.
Yeah,
Yeah,
right.
hop on
Chip
up,
and Trevor. Okay,
get
I'll just
that
remember
away.
y'all.
Alrighty.
Oh shit! Ouch! Yeah.
Let's
Hey,
see.
Mr. Kowalski.
And pass out 3 there would be the best. There you go. All right.
Okay, so it's high blood pressure, joint and muscle pain, difficulties of memory, concentration, headaches. We can skip abdominal pain. Mood disorder she has. And, yeah.
Alrighty. Well, we're gonna go ahead and get started. Just trying to move as best you can. We'll be in and out in about just a few minutes.
I can't see any Slaughtermeese does. Technically would be getting the,
All right, Jala, I'm almost done here. Just need to check the scans here, see if anything abnormal shows up.
Sounds good.
Unfortunately, MRIs can't diagnose like any kind of migraines, cluster headaches, or tension headaches, but it can at least rule out if there's like, you know, fluid buildup, abscess, tumors, that kind of thing.
Yeah.
Well, in terms of the brain scan, looks like everything's pretty good. Look pretty good here. How does your shoulder feel normally at the left one?
I tend to get sore all over, so
Just like wakes up as if it's just kind of sore without much work on it.
I figure I might have slipped on a rug or something every now and then.
Yeah, okay. All right, then I'm gonna go ahead and turn the scans over there. See what they show up for me. Jolly, go ahead and hop up. We'll get outside.
Sure.
Here's your stuff back.
Thank you. Alrighty.
Alright, so in terms of the brain scan, it doesn't look like anything is out of the ordinary. Could just be like either a migraine or cluster headaches. Have you felt those in the past before?
Yeah.
It could just be that based on the scans. So there's no infection that I saw, no tumors or any abscesses or anything like that. Your shoulder, though, there seemed to be some kind of mass in that region, though. We won't know. I'll have to do a biopsy to confirm that. But usually, it's in that location. It's usually benign.
Sure. Is it connected to headaches or?
It might. Not exactly sure. Oncology isn't really my strong, so I could get Chip up here to get a better look at it.
Sure, why not? I don't mind waiting a tiny bit. Not like his headache's going away.
Alright. Chip, what's your 20?
Hello, can I help you?
Okay.
Well, Jala over here has been complaining of headaches. That's been kind of disoriented. No double vision, but it seems to be giving her quite a bit of trouble. Kind of keeps her from focusing. I did an MRI scan and showed no infections, abscesses, or anything like that. No tumors.
No tumors, no nothing?
No.
Okay.
No, but there is one. The scans that show up a small mass in her left shoulder.
Small mass in her left shoulder. Okay. That's peculiar. We'd have to probably do like a biopsy on it to see what it is.
Yeah, that's what I recommended.
Yeah, I definitely recommend a biopsy so that we can figure out the nature of that mass. And then I mean, if it's benign, can definitely see if it's like maybe applying pressure to some a nerve ending or something like that that causes the headaches to happen.
Yeah, I guess.
Papa 20.
Was that me? And Papa 22? Not that I've seen, no.
But yeah, no, that's definitely peculiar that that you're experiencing these headaches, and you have a mass on your over by your shoulder. Do you know how far is it from the neck? The mass, I mean. Welcome to Justice.
Yeah, it's this scan right here. Yep.
Okay, let's take a look at it.
Oh yeah, that's pretty close.
It's pretty close to the spine cord. It looks like it's pretty solid, so hmm. Okay. And that's definitely something that we can definitely, like I said, I definitely suggest doing a biopsy on that mass, and figuring out what it is, and then kind of just coming up with a game plan from there.
Random question: were you shot recently?
Been a while since I've been shot.
Okay. Were you shot in the shoulder by the time when you were shot?
I lost count how many bullets I've taken.
Okay. Have you had any previous injuries to this area where that mass is developed?
To be honest, I really lost count.
Okay. I just want to make sure that's not just a massive scar tissue. But we can definitely, like I said, I definitely suggest doing a biopsy on that mass, seeing what it is, and then kind of just taking a, I guess, just taking a gander of where it is on the shoulder. Make sure it's not, you know, conflicting with any nerve endings, or even possibly blocking some spinal fluid from flowing of some sort.
When should we get this biopsy done?
Um,
Uh,
I
I'd
would
say as soon
suggest
as
as soon as possible.
Yeah.
Sure, why not? How does it work?
Well, I think in terms of the situation we have at the Pillbox, we can set some time now for it if you like.
Yeah, we can definitely schedule it out.
Does that mean I need to go wonder?
I'm sorry, I didn't catch that.
Does that mean I need to go wonder?
For something like this, typically not. We can issue a local anesthetic to deaden the pain a good bit.
Yeah, it'd be local anesthetic for that. Um,
Sounds
if
good.
We could do it.
that's what
We
we
could do
prefer.
twilight. That would be
Yeah,
like putting you not under, but you will feel very woozy. For a
kind of
while.
laughing gas type of thing.
Yeah.
Okay. Sounds good. I'm just gonna
All right.
fire off a text. Let's at least someone know.
Alrighty, I'll get prepped.
And four. And four.
Who does Jala trust the most?
Hello. Yeah, I hurt my back. Yeah. I may or may not have fell off my bike. I thought it would go away
We
after
can do
a
this
while.
in the operating room.
Decided going to get kicked out.
Do I need to get change or anything?
No. It's more of an irritation, but it's enough to where it's there.
What do you think?
I think for something that localized, we shouldn't need to.
Yeah, we shouldn't.
Alrighty. I guess I better take off my shirt at least.
Yeah.
All right, I'm gonna go ahead and get this set up here.
Alrighty.
Toilet. That laughing gas hooked up here.
Looks like you've been through a lot.
Okay, I got this all set up here.
Alrighty.
All right, I'm gonna go ahead. I'm gonna put this on your face here. Just want you to take some nice deep breaths in. Okay. All right. Okay, let's take a look at this here.
Let me get this endoscope prepped here.
Yeah, go ahead and get the endoscope ready. I have the sample tube here ready. I'm gonna go ahead and load that into the endoscope.
Alright.
That'd be great.
Okay. I'm gonna go ahead and clean up the area with a little bit of iodine here, just to make sure it goes in nice and sanitary. Okay. That's definitely not normal. It's bleeding a lot more.
Mm.
Do we know if she has like if she's on any medications for blood thinners or anything like that?
No, nothing prescribed.
Okay, this is interesting. I don't know why this is bleeding more than usual. I'm gonna go ahead and grab that. I'm gonna go ahead and let's grab that that sample now. I don't want to risk any
Yeah.
more blood because this blood's coming out pretty quickly. So, all right, go ahead and align it with the mask there. And then what I want you to do is I want you to pull that. She's starting to pass out here. That's not good. Yeah, go ahead and
Yeah, I'll get these probes here and
get those
vitals
probes
checked.
going.
Good.
Um,
That won't work.
I probably should get a IV bag just to make sure because it looks like an IV started here as well, just to make sure. We'll get that started. Awesome. Okay. Um.
Yeah, you got this.
Yeah. Okay. Okay, so we got fluids going in there. Looks like we have a high blood pressure here.
That's pretty high.
That's probably also the cause why it's bleeding so much right here. We definitely need to make sure we administer some medication to help lower that blood pressure, or find the reason why it's so high.
All right, I'll go ahead and push some cardizem to get that blood pressure down.
Oh, there's a seizure part. Kiddo, I need to focus on what they're doing.
She's starting to shake a little bit. She might be starting a seizure. Go ahead and put her on her left side. Go ahead and put her into the recovery position, just to make sure, and also put a tongue
Kiddo, please.
pressor in her mouth so that she doesn't bite off her tongue.
Definitely on left side. So definitely on left side.
10-4, thanks for your shift.
Okay, let's go ahead and get a read on the vitals and see what we got here. Affirmative. Okay. I didn't mean to do that, but no. Okay. At least it's lowered a little bit. Let's wonder what could be causing this.
I'm not quite sure. We haven't gotten the sample yet, have we?
Okay, so stop shaking. We can go ahead and move her back. Let's go ahead and, I did get the sample. Let's go ahead and get that area closed up. And let's go ahead and,
You might want to
go
get
ahead and take a little bit of a blood sample so that we can figure out, if there's any,
Alright.
Oh, I made him panic.
I'll go and get the blood sample here.
Yeah, because I just want to make sure that there's nothing, nothing in the blood that could be causing the issue. Because other than that, I mean, it has lowered, but I can't think of anything else that we could check. I mean, I got the blood sample, got the biopsy. Okay. Let's go ahead and I'll have you go run that blood test. I'm gonna go ahead and get the blood sample. I'm gonna get the biopsy sample here ready to go back into the lab. Okay.
All right, I'll
Alright.
go ahead and run that test.
Okay. Go ahead and get a bandage on that. Okay. Yeah, that looks like a piece of metal. Okay, let me go ahead and take a look at this metal a little bit closer here. That's definitely a piece of metal. It's like a bullet. Part of a bullet. Hmm. Strange. That's like a big hunk of. That's a big hunk of metal for. Wonder. Let's see what Cliff gets.
What will you do now?
Ah, okay. Do we know how much we have in the blood? Is it greater than 45? Okay. I'm gonna go ahead and start the chelation therapy right now. Okay. Got the chelation. And I also, on reviewing, I looked at the sample. It looks like it's a piece of metal, a bullet.
Well, in that case, okay, that means we just got a fragment of it.
Yeah, I think that mass might be the cause of the lead poisoning in her system.
All right, that means we need to go back in and get the rest of it out.
Yeah, we're gonna have to go back in. go ahead and give general anesthetic so that we can start, because we're going to have to go full in. I'm going to go ahead and start an oxygen mask on this as well.
Alrighty. Let's see, general anesthesia, the counteracting drugs,
There we
regulation.
go.
There we go.
And so turn it on to 60-40 mix. All right. I'm going to go ahead and undo my stitches that I did here. Luckily, I keep a little loop there to kind of just make it go undone really nice and easy. But
well, when either of us are able to do sutures, it's kind of the same way. It's like easily, yeah.
yeah, that bleeding though is really starting to bother me.
So I'll get suction on that. Get that out of the way.
Yeah. Okay. I'm gonna go ahead and make a smaller incision here on either side of the mass. There we go. Thank you. Okay. Make sure that I can get all around the mass here and remove that mass from this area here. Let me make sure that there's no. I'm actually gonna make sure this isn't on an artery. That's another thing I should have checked for.
Yeah, with this much bleeding, yeah.
Yeah, I wonder if it's pushing on an artery and forcing it to bleed. Should we let Charlie go on the call?
Yeah, I think so.
Okay, so it looks like we do have a little bit of piece of that artery has been cut here. Can you let Charlie know that she can go on those calls?
Yeah.
So that she doesn't have
Charlie, you have as your FTO, you have my permission to go on that call.
Okay, I'm gonna go ahead and I'm gonna see if I can go ahead and repair that nick there. That's where the bleeding is starting. That's where at least where the bleeding I'm seeing is coming from. All right, I'm gonna go ahead and get these micro sutures going here, just because I just want to make sure nice and slow. I want to make sure we get that bleeding stopped, because like I said, that bleeding is really, really bothersome.
So at any nick in any artery, really.
Oh yeah, any time. Okay. Looks like there's some smaller arteries here, and also some veins have ruptured just a little bit as well. I'm gonna go ahead and start repairing those as well. As well as I'm gonna get that mass out, because that's all stemming from that. Once we get that, we can actually start cauterizing, and then we can start rebuilding some veins and some arteries.
I think at the moment the veins are kind of I guess secondary. We can clamp those up and
Yeah, we
get
can
that
clamp those up.
mass.
Just the artery is the main. I'm gonna get this
that
mass out
slug
here.
out.
Yeah. Yeah, it's a big old piece of metal. Okay. And got that out. Nice and easy like. Let's go ahead and start microsuturing the
Alright.
there's just some broken chunks here. Go ahead and clean that up here. Some saline. Just wash it out as best as possible here. Make sure the nerve endings are still good here as well. Okay. Beautiful. All right, I'm gonna grab these two pieces here, nice and slow, like with some forceps. Okay. Nice and slow. Straight up. There we go.
I'll be right back. I need to
Okay.
get that call up front.
All right. I'm gonna go ahead and start doing some repair on some of the arteries here. I just want to make sure that that bleeding starts to slow. We can get that medication started for the lead poisoning. Okay, beautiful. It is starting to slow, starting to regulate here. That's good, that's good. Okay. I'm gonna start working on those veins now. Okay, here we go. And some of that vein reconstruction. All right, I'm just gonna go ahead and check the wound area again, just to double check to make sure I got everything out. Make sure there's no other ruptures of any arteries or any other chunks of metal left in the wound area. Okay. Okay, looks like there's some scar tissue from the past, from past surgeries. Looks like something else got torn out of it. Okay. All right. I'm gonna go ahead and. Oh, it's crude. Okay. That's pretty crude. Let me just double check to make sure that there's nothing bad has happened to this area. Make sure there's no infections of any kind. And take a little bit of a biopsy of that scar tissue, just to double check. Okay. It looks like everything is good here. I mean, even though was crudely removed, it looks like it was cleanly removed, so there's nothing left in there. Go ahead and start patching it up here, and double check your vitals. Okay. Definitely have to worry about that high blood pressure. That could be also contributed from the light poisoning. But let's go ahead. This. Okay. Go ahead and get this cleaned up here. Get that sutured up again.
I ate my fork.
You should be able to do that pretty easily.
And then there we go. Go ahead and clean up the stitching area here, some saline, just to make sure it's nice and clean. Go.
Just passed up
And I'm going to go ahead and put a bandage on that. And then
once again. Alright, now we'll reopen.
go ahead and get you into recovery room so that we can monitor your vitals and
Just make
get
sure
you on
your future
that chelation therapy.
Philip C's
And get that
right?
blood poisoning taken care of. Okay, and bandaged. Alright, I'm gonna put you on a stretcher here so that we can get you into one of the rooms. Hey, Cliff, which room is Pedro in? He's not in the cat room, is he?
Yes, he's in the cat room.
Okay.
What are we looking at?
So I got she's still unconscious right now. Blood pressure is still high, but I went ahead and I did get the mass out.
And all the fragments.
All the fragments. It looked like beforehand. It looks like there was some somebody went in there and dug it out. Um, a and a previous injury, pretty crudely. But I went ahead and I repaired the arteries, in the ruptured blood vessels in that area. Um, I also got it nice and like I cleaned it out as best as I could, and I've also started her on the solation therapy through her IV, so that we can start getting that into her system, so that her system can fight uh, uh, this
Get rid of
lead
the lead
poisoning.
poisoning. Yeah.
Yeah, which that should help with the high blood pressure as well. I hope. If not, we're gonna have to figure out why it's what's causing that high blood pressure.
If anything, at the very least, I would say it's probably stress related.
Yeah, it could be stress related due to due to having to deal with that wound on the shoulder. But I think we'll just once we get that solation therapy, do that whole solation therapy. I believe she's also a private lawyer too. If I remember right.
She is, yes.
And that is a pretty stressful job, believe me. So we can possibly prescribe her some blood pressure medication to help regulate the blood pressure. Um, Other than that, I mean, there's not really else much I can do. Um, I mean, that's um, at least we were able to find out that she did have that lead poisoning and that hunk of lead still in her shoulder. That should help her out tremendously.
Yeah, definitely. Especially with the arteries and veins that we got repaired on the way.
Yeah, I should get a lot more blood to her brain, which then should also take the pressure off of that from having lack of proper blood circulation.
Yeah. But yeah,
Since you're
from
the
what I
high,
understand, the chelation therapy is like the administering the medication to bind with the lead and just kind of pass it out.
yeah, you more than likely you'll urinate it out. It just
hmm
will takes a little bit of time. We also got to figure out why she's unconscious as well.
Oh, she's still under general anesthesia. Let's see if we can.
Yeah, let's go ahead and reduce. Let's go ahead and take her off that and see if we can wake her up.
So we did put her under general anesthesia for the operation.
Beautiful. Okay, she should be. Let's get her hooked up to everything here and just double check her vitals. Let's go ahead and administer some lisinopril. That will help with the blood pressure.
Yeah, let's see. What do you think? Start at around 10 milligrams?
Yeah, we should get her started on some lisinopril. That will help with bringing the uh, bringing her blood pressure down. It is an ACE inhibitor that helps with making sure that the blood pressure is at a more regulated part.
Mm-hmm. Yeah, because I think the max for that is like 80 milligrams. So starting off at 10 and go from there.
Yeah,
See if
yeah. We'll go ahead and start at 10,
yeah.
and then move it up move it up as high as possible. You know, if it doesn't make any difference.
Yeah, looks like blood pressure is going down a little bit further.
So it's starting to level out here. Okay,
It's starting
awesome.
to. It's not quite there yet.
Yeah, at least it's on the right path. That's exactly what we want, though.
Yeah. Hmm, 10-4. Yeah, the general anesthesia should be about reversed by now. Just wait for her to wake up on her own.
Yep.
Okay, this amount of time has passed. It's very unusual. Let's see if we can do a CT scan. See if we can show any. See if there's any hemorrhaging somewhere.
Yeah. Yeah. Let's go ahead and get her into imaging. Let's go ahead and see if we can see it. So yeah, I'll let you leave. I'll leave you to that.
All right.
I think from here, I mean, I don't really think that I'm needed any further here.
All right. Thanks for your help.
Hey, not a problem. Glad I was able to help.
All right. Alley.
If you want these numbers, I'll get them written down for you.
Yeah, please do. That'd be great. Chip, if there's anyone waiting outside for Jala, give him an update. Just swap this thing over for a CT. It's still fine. Let's see about the clavicle there.
I kill.
Okay, there's a lot of scar tissue here, but I don't see anything out of the ordinary. Let's go ahead and move the scan over to the heart and lungs, see if there's anything there. Yeah, what the fuck happened? It's interesting. Such a hodgepodge of. Okay, this was done right. This one not so right. Huh.
Hi. Do you want to speak to the dogs?
last operation looked like it went well. Don't see any complications. Hmm.
Oh, I'm so sorry, man.
All right, let's try a different room here. Alrighty. Okay, let's hook up to some more oxygen, get some. Make sure these IV lines are good. Alright, so what does it say here? wrong? Good question. Let's see here. Let's do some reflex movements here. Check breathing too. There you are.
Oh, this will be amusing. And gun just go off.
Papa 22 is going to go 10-7 for about 10-15 mics. So we got Paul Nintendo is on his way. All right, let's get started on this report here. Yeah, Mr. Nintendo. Yeah, send him over to Ward C. 10-4.
I do not know which room he's in, but
Me either.
we're back here. Cliff, which room are you in?
Right over here.
Oh, right over there.
There we go.
All right.
Perfect. Alrighty.
Yeah, she came in complaining about headaches, and
Uh-huh.
we did some scans, found a foreign object in her left shoulder.
Okay,
We
gotcha.
were able to remove it. It was a bullet.
Okay.
But in the result, she kind of slipped into a coma in the meantime. We haven't been able to wake her back up.
Do we know where the bullet came from?
Not a clue. It's an old bullet. It fragmented quite a bit. We had to repair some arteries on the way.
Okay, gotcha. How old is the bullet?
We've sent in for a test for that. Haven't gotten the results back.
Okay, like old as in like a day, or old as in like 10 years? Like, what are we thinking?
Let's have a look. See. It was certainly enough to hike her blood level up to much more than tolerated.
Okay.
We started her on therapy to get rid of that poisoning.
Okay, gotcha.
Let's see. In terms of how old the bullet is, by my guesstimate, it's about. Let's see.
Does this confuse you, sir? Is this too loud for you?
Holy shit! What is that? That was horrible.
Oh, Jesus Christ. Mop. Mop.
Is this too loud for you, Grunt? Do you need me to get louder?
Do you hear that?
But I would say the age of the bullet's between about between 2 to 10 years, give or take. It's kind of hard to tell at this point, but it's definitely old.
Okay. Did you hear that megaphone?
Yeah, and I'm still ringing from it. How?
I'm gonna get them to stop.
Yeah, you can tell them there's no I in team, but there's 3 U's and shut the fuck up.
Right.
But we'll definitely keep her here, keep her monitored, and we'll let you know if anything changes.
Any kind of estimate on like an outcome, or like do we have
Outcome-wise,
any idea?
No idea. It just depends on her.
No.
We've repaired everything from in terms of the CT scans, MRI. Nothing else seems to be out of the ordinary aside from the past injuries she sustained.
Alrighty. All right. I'll get in contact with some people and make sure that some of her work gets covered. Let's see. All right. Let's see. All right. I'll see if I can take a look at some of her files and see who some of her clients are, so I can let them know what's going on. She won't be around. Yeah, please, as soon as something changes, just give me a call and let me know.
We'll do. Yeah, I'll let other personnel know, and I'll make a note in the report as well.
Yeah. Yeah, you can put it on her profile too. Just you can just go ahead and put me down as an emergency contact, because I really don't know who else, and I don't think she's really close with anybody else in the city. Not as close as me and her are. So.
There was another number, CJ.
Oh, yep, CJ. Did you contact CJ?
I have not yet.
Okay. Uh,
And don't know if
okay.
you know Jose Rodriguez either.
Yeah, let me see. I can call them. Hey, Jose. Hey, you there? Hey, where are you at right now? Can you head down the Pillbox? Jala. She listed me, you, and CJ as her emergency contacts. So you can head down here. She's in the ICU. All right, bro.
Okay, there we go.
Hey. Where you at? Hey, where you at? Okay, can you come to Pillbox instead? I don't know. What do you think? Yeah, she's here. She's listed the three of us as her emergency contacts. Are you already aware? Like, are you already aware of what happened, or? Gotcha. Okay. Yeah, she's here. They did surgery and they found some sort of a bullet in her shoulder, but it's an old bullet. So I don't know. I'll have the doctor explain it to you when you get here. But she listed me, you, and Jose. So I figured I'd make sure the two of you came down. Jose is on his way here from Taco Farmer. Rodriguez. Okay, sounds good. Just for right now, just have you come to the ICU until we figure out. No, Aria's fine. Just you and Aria. That's fine. So. Yeah, well, she's unconscious, so. Yeah, she's completely incoherent. So. But this way, I want you guys to. Okay, I just want you guys to hear from the doctor what's going on. So. All right, cool. All right, sounds good. All right, CJ's on her way. Well, CJ's pulling in now. So if you want to let them know that her and Aria can come back. And then Jose is on his way. Yes.
Really, kiddo?
All right, man, we'll do.
All right. How long you been here, Cliff? Total.
In this city?
Yeah.
About almost 5 months.
Okay. Did you take a break for a little while or no?
I have been taking breaks here and there. I'm kind of sporadic. I need to fly out to
Okay.
family.
Gotcha. Okay. I'll say I thought it's been a little while since I've seen you.
Did not mean to do that. Yes, sir, I do.
Yeah, they do.
Now go by pictures on the wall.
So when did you become a doctor?
I actually became one about before I got into city. Actually, I was in another city working EMS.
Oh, okay.
Just kind of went from just kind of probably the new basic triage to up to paramedic there, and just got my MD license on the way.
Oh, okay. Hey. I figured we'll just wait for Jose to get here. This way he only has to say it once.
Okay.
Yeah. But Jose was at Taco Farmer, so he's on his way here.
In truth, I never quite brought up the whole doctor title until I became authorized to do so.
Oh, gotcha. That makes sense.
Yeah. If a CJ comes in, you can send.
That is
Michael.
I'm
that
right
is
here.
that
We're
is
just
CJ.
waiting for Jose.
Looking for Jose.
Oh, Jose, that's what it was. Sorry.
He's almost here. He said.
No, I'll just get back to my report.
Yeah, I gotta go on my head for just a moment too.
Yeah,
Okay.
sorry, strike that Jose Rodriguez. Alrighty.
Cap said Jose's coming in.
Alrighty.
Oh, here. I'll stand right here so I'll know.
Yeah, and CJ, it's not that I didn't want Cap in here. I just want too many people in here. You know what I mean?
No, I get that.
Yeah. So I don't want him to think like I didn't want him in here or anything.
No, I just we were driving around. One of ours is trying to propose to his girlfriend, so we went down to the pawn shop, and we were headed back to the bar.
This room. Yeah.
All right, Doc. Now you can go ahead and go over everything.
All right, so Jala here came in with complaint of headaches and said that over-the-counter meds and such other pain-relieving devices were not working. Well, devices as in just like, oh, damn it.
Oh!
Oh, yeah, I know. She's been smoking joints for the pain.
Yeah, that. And well, we did some scans and showed a little small mass on her next to her clavicle, her collarbone.
Huh?
And me and Chip Kowalski over there at the lobby, we both worked to extract it. Her blood pressure was really high. I would assume from her job. But once we were doing surgery to extract the mass, which is a very old bullet, about at least a couple years old. So it had fragmented and the lead was getting into her bloodstream.
Okay.
We've since treated that. We've put her under chelation therapy to get rid of the lead poisoning. And during surgery, she had slipped into a comatose state and has yet to wake up from it.
Okay.
Do we think she will wake up from it? Like, is it lead poisoning or?
It might be. Right now, it's working its way through her system. Has yet to fully pass.
Okay.
Pass from her body. At this point, it's up to her as to when she recovers and how long it'll be. You know, in terms of comas, we don't really have have an estimate. It's all depending on
Right. Yeah. No.
recovery,
We're just looking to see, like, your professional opinion.
Yeah, we've done all sorts of scans before and after, and aside from scar tissuing, all that you can see there, it's nothing else seems to be giving any complications or causing the coma directly.
Gotcha. Okay.
You think you
Alrighty.
treated the lead poisoning early enough? I mean, it sounds like it's been in there for a while.
Well, we treated it as soon as we found out. We ran a blood test, and that's what it. Yeah.
I mean, like, you think it's like early enough to not have caused permanent damage?
In terms of that, if there was any permanent damage, the CT would have picked it up, and I didn't catch anything.
Okay.
And when she wakes up, we'll
Well,
do
that's
some
good.
routine cognition tests to make sure everything is and make sure there's no damage to the brain.
Okay.
We've also put her on some lisinopril to help keep the blood pressure down. And it's starting to work, but it's not quite fully back to normal levels yet.
Okay.
How's her vitals right now?
Let's have a look-see. Pulse is strong. BP is still a little high, but it's a lot lower than where it was.
Okay.
Well, that's good.
Is there anything you need from us, as her doctor or Paul?
No, I'm in the same boat you guys are. So if
Yeah,
he
at this
needs
point, we'll
anything
keep her
from
under
us,
observation. We'll update you guys when something changes. In terms of the chelation therapy, that process, in terms of the adult therapy, that process usually takes no more than like 3-4 hours.
Okay. Okay. So she should be good in the next few hours.
Yeah. The therapy will have like we put her in an IV to bind with the lead particles so that just pee it out.
She's supposed to look a little pale right now.
All right, let's see here. Usually cold and clammy skin is like a minor condition, but let's recheck the heart, make sure nothing's wrong here.
Sorry, I can't hear you.
So I was just talking to
shit,
myself.
sorry.
Jesus Christ.
Wow.
He said usually cold and clammy skin's a minor condition. He just wants to check, make sure nothing's wrong with her heart.
Oh, yeah.
Yeah.
I'm not the only one who heard the explosion, right?
Nope, you're
All
not.
right, y'all get outside.
Okay.
Usually the explosions at the train yard, we get those.
Oh, okay.
Somebody trying to do a job to get away and fucking cry.
Yeah, that's true. I forgot that,
What
that
you got?
people take that one jump to try to get onto the freeway. Yeah. Not
The
because
one
I've
where the
done it
officer like
before.
knocked me and flew me across the freeway.
Yeah,
That one?
yeah, that one. Or no, that's a different one. He not that I have ever done that, you know.
Right.
I know, you don't give a fuck though.
I don't give a fuck.
I've never done any crime.
Yeah, Paul, I've never done any crime before.
That's
ever.
right. I might be leaving the DA's office anyway.
Don't you fucking dare.
Paul, no,
Yeah.
please, for the love of
Yeah,
God,
meet me at
no.
Pillbox.
I need you.
That was something else I was supposed to talk to you about today. Don't you fucking dare.
I need you there. And I need her not to
Gotcha.
die. We all need her not to die. We need you there. Please don't do it, buddy.
Yeah.
Don't make me cry more.
No, I know why CJ's saying that she wants him to stay. I just can't work with her, CJ.
We'll get her out. You just gotta do it the right way.
Huh? I'm missing something, aren't I?
Yeah, I haven't gotten to fill you guys in. It's been a hectic day.
It's okay.
In other words,
later.
if I leave the DA's office, Jenny's probably gonna take over.
If you leave the DA office, you may
No.
get stabbed. We don't talk about it.
Please. Please, for the love of God, no.
Is it me or does Jala have dog tags?
I think I've seen them before.
Yeah, I think so.
Please, for the love of God, don't do that to us.
What was that, a tattoo?
Yeah, you're not allowed to die, and he's not allowed to quit. So if you can hear me, you better fucking survive.
I will bring you back. I will hold up what Jose would help me. What's it called when you bring people spirits back? What do you call it?
Resurrect?
Is that it?
We'll resurrect you and put you in Paul's body. Just think of that. Do you want to be put in Paul's body or your own?
Right?
Wait, we're.
Oh wait,
But
then
we would have to get rid of. But we would have to get rid of his soul to do that. Why would? That's a lot of work.
We'll body swap him.
But then Paul would. I'm too tired to figure all that out right now. Either way, she's not allowed to die though. It's not happening. Tell everyone that I will bring you back from the dead and kill you myself if you die.
And then bring you back from the dead.
Trying so hard enough.
Exactly.
Alright, well, it could be the cold and clammy skin is probably just a
Got you.
side effect of the chelation.
Okay.
So it not only removes
Okay.
like toxic metals, but vital metals as well. So we'll keep that replenished.
Okay.
Oh, okay. Gotcha. Like her iron and stuff like that.
Yeah.
Gotcha. That makes sense. All right, Doc. Well, thanks for your help, man. We appreciate it.
Yeah, not a problem. I'll go ahead and forward my number.
I stored your number already, so
Okay.
yeah, I can send it to them.
All right, so I'll just update you first and then pass it on down.
Yeah, you
what's
can
your
call
what's your
any of
lucky
us.
number?
And right now it's 128.
Jose?
He just sat in the chair. It's fine.
I know. It's just it makes him go into the another realm.
Mm-hmm.
Oh my God! Stop disappearing into the realm.
Where did she go?
She disappeared into the same realm you did.
Oh.
Yeah, you disappear into the realms when you sit in a chair.
I keep thinking it's a joke, and she's just gonna like pop up and say, "Ha ha."
Eventually, better be,
Yeah,
we
I hope
better
so.
all be laughing about this one day.
Yeah, no, Jala's gonna come up.
We need her.
It's like a joke, like, you know, an ADA and 3 bikers walk into a hospital.
What can you say? Jala has a lot of friends in high places.
Right?
I remember when I first met Jala, I thought she got me out of a warrant that I had talked it down from what 12K to like 4K, and I was like, wait a minute,
Hell yeah.
lawyers are actually very beneficial. What you mean?
First time I met her, it was when you helped me get it out of some of my stuff.
Oh yeah.
I can't remember if I was trying to get rid of an inmate or trying to save my coworker from an investigation.
I'm pretty sure you were trying to save your
Both.
coworker from an investigation because I was there for that too.
Yeah, I think that was the first meeting.
Yeah. Because that's when I first met you.
Or another inmate's dying. I am not really sure.
not
There was a
Pillbox.
lot of inmates.
Yeah. All right, we should let Jolly get some rest.
All right.
I got to get my helicopter to a garage anyway.
Have you seen my helicopter?
Alright,
You
doctor.
sent me pictures of it.
Take good care of her.
Yeah. Nintendo, you got
Yeah,
tickets for the event tomorrow?
And if you don't, maybe what
I
I'll
don't know
do
if I'm
is
going to be
put
around
Herschel in
yet.
your body.
Well, I mean,
What?
I'll be around, but I'll be flying.
I'll take a note of that. Yeah.
Aren't I?
There you go. There's a ticket nonetheless.
Oh, thanks, man. Appreciate that.
Oh yeah, Paul.
Look at that. Follow the
Let's
squeaky
just outside.
shoes.
Okay.
Is it a physical one or no?
Yeah, it's a physical ticket.
Oh, okay. Let me
It's
try
on the
that
floor.
again.
You're just gonna have to scroll through it, maybe.
Oh yeah.
Jala, I don't know if you can hear me, but like, you know, we got your back.
Hello.
Yes, we do.
Hello.
Thanks, Doc.
Not a problem.
Whoa.
Dang.
Oh, where'd all these people come from? Holy shit.
All right.
Have I
speed
met that
writing
one?
time.
I don't remember.
Probably.
Aria, this is
Been around
Gambit.
for literally ever.
Oh, Gambit. I've heard about you. I don't know if I've ever met you.
Hey, Doc.
Yeah.
Nancy don't want to help me. Can you get me up to the roof?
Yeah, sure.
Thanks. It says I'm not authorized.